I am Dr. Arjun Kashyap, consultant pulmonologist at Shankara Cancer Hospital and Research Center. So today our topic for the day will be Chronic Obstructive Pulmonary Disease, or COPD as it is better known. In view of the World COPD Day, we shall now discuss a few things about this less known disease, COPD. What is COPD firstly? So COPD is in layman terms, it is a chronic lung problem which has airflow obstruction and causes respiratory symptoms such as cough or wheezing. Now we will move on to the risk factors for COPD. So smoking is one of the most common risk factors for COPD, which is also the preventable one. Apart from smoking, other risk factors such as genetic predispositions, childhood problems such as prematurity or chronic lung infections in childhood, environmental exposure to tobacco smoke as in second-hand smoke or passive smoking, also environmental exposure to other pollutants that we commonly see in air pollution, and occupational exposures. So occupational exposures such as gases or heavy metals can lead to COPD. The theme for this World COPD Day is breathing is life. So act earlier. Act earlier. This emphasizes on the early requirement for monitoring lung functions, particularly in children who have been born premature or have had a tough childhood with repeated respiratory infections, or in those who have a genetic predisposition for COPD, such as those with alpha-1 antitrypsin deficiency. With effective treatment for COPD, the patients can have a near normal life. So now moving on to the symptoms of COPD. The symptoms of COPD, as we earlier mentioned, is cough, breathlessness, wheezing, chest tightness, breathlessness on activity, and increased frequency of respiratory infections. Also, COPD is now known more as a systemic disorder because its association with loss of weight, with diabetes mellitus, and also certain links to lung cancer have been established. So now moving on to the diagnosis of COPD. The diagnosis of COPD is primarily by two things. One is a strong history suggestive of obstructive airway disease. The second thing is a pulmonary function test. Hutchinson in 1846 discovered the spirometer, which now forms the basis for our diagnosis of COPD in any patient. Also, imaging such as chest X-ray or CT thorax can help in further categorizing these patients with COPD, also to outline the management for each one of them. What is the treatment for COPD? The first and foremost important thing in the management of COPD is smoking cessation, because smoking causes irreversible damage to the lung, which is generally progressive even after cessation of smoking. So smoking cessation, number one. Second thing, there are a few medications, pharmacotherapy. So there are few medications known as bronchodilators, PDE1 inhibitors, some of them known as methylxanthines, that all help to ease airflow limitation and thereby decrease the symptoms of the disease. Moving on, oxygen therapy. Oxygen therapy forms an important part of the treatment of COPD, particularly in patients who have hypoxemia or resting oxygen saturation of less than 90%, as it helps in controlling most of their symptoms and also helps in preventing right heart failure secondary to COPD, known as cor pulmonale. Once we are done with pharmacotherapy, or we have reached the ceiling for pharmacological management, then there is an option of something known as pulmonary rehabilitation in these patients with end-stage lung diseases with COPD. So pulmonary rehabilitation is a set of exercises that tend to target muscles other than the main muscles of respiration, which will help to alleviate the symptoms of breathlessness also help in improving activities of daily living. Certain other options for patients with end-stage lung disease with COPD are surgical interventions in carefully selected patients where emphysema is limited to a particular lobe. Also, now we have the various bronchoscopic interventions such as one-way valves or bronchoscopic nitrogen cryosprays in patients who have emphysema, and which will help in bronchoscopic lung volume reduction, or it is known better off. So they will help in controlling the symptoms of COPD and improving the quality of life for the patient. So finally, if nothing works and patient has repeated infections leading to hospitalizations, these infections are known as exacerbations. If patient has repeated exacerbations leading to frequent hospitalizations, an option of lung transplant may be given to a carefully selected patient after looking at their nutrition status and performance status.